Okay, well, thank you very much for the opportunity to present here. I'm excited to be part of, to be invited back to speak and to be part of this what'll perhaps be an inaugural launch into a whole parent section of the SCD Diet Association. So Jeffrey asked me to give some practical and useful advice on really sort of navigating, childhood IBD. And so that's what I'm going to do here. I'm going to cover a variety of topics that I was asked to cover. So one is navigating the educational system, navigating the medical system, learning how to let go, really passing the responsibility of, this whole process to your child, and really how to get your child to take their disease, seriously, so they don't get sick, and also to comment on the importance of diet. Now, I'm a little bit of a nonconformist, so I'm going to take this in the opposite order. So a little bit about me to start with. I'm technically a pediatric gastroenterologist. I trained and am board certified in pediatric gastroenterology, hepatology, and nutrition. I'm one of the first doctors to actually be to receive additional training specifically in inflammatory bowel disease. I trained at really was probably the first true IBD center where we only see patients with inflammatory bowel disease. And it's been my professional focus for the last roughly 25 years now. So about a quarter of a century, just kind of hard to wrap my brain around a little bit also. We see patients from all over the state, the country, and really beyond anywhere. And I see patients that are from toddlers to great grandparents, so the whole kind of spectrum of IBD there. So I do treat a lot of adults and teenagers as well. And many, if not most of my patients actually have another GI doctor. A few years back, we decided to, even though we just do IBD, actually create some subspecialty programs. And so I decided that I definitely want to do the nutrition and what's called integrative IBD program. And that's what you see up here. We have a variety of other programs as well, including a psychosocial program. Yeah, that's kind of a little bit about me. Although technically I'm Western trained, I do sort of incorporate a lot of non-Western therapies into my practice. I used this in one of the presentations I gave last year at the conference, where this is sort of like my IBD plate. Western meets Eastern. So you have like traditional options on one side, and then you have alternative or kind of more Eastern options over here. And then there's my belief is that if you actually combine these two, into more of a complementary integrative approach, you're really going to get the best of both worlds and really go from feeling better to really well, and ideally staying that way. Now, just for definition's sake, alternative means in place of conventional medicine. Complementary means together with conventional medicine. And integrative is really an attempt to bring conventional and complementary approaches together in a real coordinated fashion, with a real emphasis on nutrition, exercise, stress management, and also a strong support network. And I think those are all very important things. Now, if you think about, control what you can control, right? So traditionally, we think of non-modifiable factors as being age, also ethnicity, genetics, gender. It turns out that age, we think of chronological age, but there are diet and lifestyle things you can do that could potentially alter your physical age, and make you a little bit younger or older, depending on how you live your life. And there's a concept of epigenetics, which is sort of like beyond just pure genetics. Someone's trying to get in here, sorry. Jeffrey, someone's trying to get in the room. There you go. I don't know, can you allow them in, or? All right. All right, so epigenetics are modifiable factors beyond just genetics. So it's actually a little bit, there are things we can do along those lines, but sort of the more traditional modifiable factors would be, eating, getting enough sleep, exercising, stress management strategies, social and support network, and even spirituality. Now, this is a question that comes up a lot. Patients ask it. Doctors always kind of fear this question. It comes up usually at the very end of the visit. Does diet matter in IBD? And if you go on the internet, you'll see everything from you should have no fiber at all, to you should be a raw vegan, to you should be paleo, and pretty much everything in between. And I think what patients hear, and actually what doctors will, like trainees will tell me and other doctors, is that, one, diet doesn't matter. I hear that too. That there's no data, so that as a doctor, I can't really give advice because I don't really know what to say. I heard that as recent as yesterday. And well, okay, it may help with symptoms, but it's not really going to influence the disease at all. But diet does matter. So I'm going to be very clear. I put that up there with exclamation mark. And, I'm going to justify that in a second here. Now, nutritional goals historically in IBD kind of focused on optimizing nutritional status and also preventing disease or treating malnutrition, as well as minimizing foods that really bother someone's symptoms. But in 2020 and beyond, I used to have question marks after all these comments here, but I removed the question marks and I made them check marks, because diet and nutritional strategies can actually be used to reduce inflammation and even achieve remission in IBD. It can potentially help reduce medication exposure. It can reduce the risk of IBD relapse or recurrence after surgery, can reduce cancer risk, and can even help with treating extraintestinal manifestations of IBD. Those would be things like joint pains, mouth sores, and things like that. And so, what does the average American diet look like? This is just something I pulled off the internet, and you can see that it's very varied, right? In real life, there are the people that choose to eat the stuff on the left, and then there's people that choose to eat the stuff on the right. So diets can vary a lot. But the reality is that for many people that the map looks a little bit more like this. Now, if we look at processed foods are foods that have undergone some sort of biological, chemical, or physical alteration to really an attempt to improve their taste, their texture, and shelf life, which means that they're going to have more sugar, more salt, they're going to be lower in vitamins and fiber and micronutrients. And ultra processed foods are those foods that contain little or no food at all. Or whole food at all. And there was a study that suggested that ultra processed foods contribute to 25 to 50% of the average American or Canadian diet. And as part of that, you're going to get these things called microparticles or nanoparticles. These are often like things used as whiteners or anti-caking agents that influence the color, consistency, or appearance of food. The two most common of those being titanium dioxide, or this ALSI type thing that you can actually buy on Amazon. I Googled it. You can see the picture of that there. If you just Google this term, right, TiO2 food, you'll see this, and it actually looks more like this. There's like a whole variety of different things out there and products that'll show up with these compounds in them. What's interesting is that if you look at animal models, and if you look at and you give TiO2 to these genetically predisposed mice, you can actually create and exacerbate inflammatory bowel disease. So there is something real there. It may not be an effect for everybody, but in people who are genetically predisposed under the right circumstances, it could potentially act as a trigger or an exacerbator of things. Now you think, well, everything that's natural is good, right? So this is a picture of a seaweed extract, and that looks like it would be something that would be, like fine and healthy. Well, this is actually carrageenan, and this is what it looks like in chemical form. This is what it looks like in digestible form. It's put in all sorts of different kinds of foods. as an emulsifier to kind of, again, help with textures and things like that. What's interesting is that carrageenan is actually used to induce, again, colitis in rats and other rodents in animals if you're looking for experimental models of IBD. I remember a number of years back, I'm on this pediatric GI bulletin board, and this kind of came up. It's like, oh, could this be bad for patients? And the thought was, well, it's not been shown to be something that it's like it's a lab model. It's not really not shown to be an issue in like quote unquote real people, right? So let's look at this now. There was actually a little small study out of the University of Chicago, and they took patients with ulcerative colitis who were in remission. That means they're having no symptoms. And they placed them all on a carrageenan-free diet. So they had to meet with dietitians. They were instructed on what constitutes a carrageenan-free diet. SCD is, by definition, a carrageenan-free diet, right? And then what they did was they gave half the study participants carrageenan capsules that contained 100 to 200 milligrams of carrageenan a day in them. That's less than the average daily consumption of carrageenan in the average American diet, which is about 250 milligrams. And then they followed these patients out, and they were assessed every 2 weeks for a year. None of the patients in the carrageenan-free diet who got the placebo capsules relapsed. 3 of the patients in the carrageenan-free diet with the carrageenan capsules relapsed. And then they saw like there increases their inflammatory markers as well. And so the authors actually did 2 things. They concluded that the carrageenan actually contributed to earlier relapses in patients with ulcerative colitis who were in remission. And they actually stopped the study earlier because the carrageenan was inducing flares in these patients with IBD, and they couldn't really justify that. So that's thought was very interesting. So if you look at foods that are illegal on SCD, it kind of looks like this over here. This is what an SCD diet, could look like. Terminology, doctors talk about this kind of diet as being restrictive. And I think that terminology matters. I think it's real. I present it more as a real food, healthy alternative diet. And that's really how I believe the diet is, so that is, it's partially terminology, it's partially presentation, but honestly, this is the way people used to eat, 100 years ago before they started processing foods and stuff like that. I did a whole lecture on a diet last year at the SCD conference. So you can watch you can watch the video if you want. I am a firm believer in SCD. I have been using the diet in my practice for about 25 years. Anyone who knows me will know that I'm really a proponent of being super strict with SCD. To the point that I have patients come back and see me in clinic, and I'll say, so how's the diet going? And they're like, oh, well, I'm not really doing SCD anymore. I'm like, oh, so what are you doing? Well, I added in sushi once a month, or I've added in potatoes, but they're organic, Dr. V. But I know you said unless you do SCD strictly, you're not really doing SCD. So that's kind of why I said that. So patients know that I'm a real stickler about being strict with SCD. And that's because to really get the best results, you want to not just feel better, you want to knock out the inflammation completely. And you really need to do it strictly for that to happen. And again, I go into that in much more detail in the presentation that we have over there. So, I'm going to move on now to talk about, like letting go, kind of passing on the responsibility to your child. Like many of you, probably most of you here, I'm a parent. I'm actually the parent of 2 young gentlemen now here. So I've kind of gone through the process of parenting as something that never really stops. How do you know you've done a good job as a parent? So I think really one could argue that the goal of a parent ultimately is to make sure your kids have the opportunities they need to really acquire the skills they need to live a full, happy, successful, independent lives. And that's really, I think, what we all want for our kids. We want them to be happy. We want them to live a full life. Essentially, you've done your job when they don't really need to rely on you for everything, which is sort of a little bit hard to digest, in some ways. And it can be particularly challenging, especially if your child has either health, or other challenges there. This is a little closer look at my family. Some of you may notice here that those really weren't, we're snowshoeing. Those weren't really just walking sticks there. They're actually canes. So both my kids are blind, but you can see that that really hasn't stopped us from living life fully. I mean, they have like zero vision. And you can see that down below, my son is surfing. And when he was like that's 6.5 years old, we even having a double surfboard there together one time. He's climbing up on the rock climbing wall there up top, and we really try to live life fully. So I know what it's like to go through the system, both the educational system and the medical system, and the struggles that are there from the parent side of things too. Now, I'm going to ask that no one take offense at any of the following pictures because, again, I get it. I live this. I can relate to it, but, we want to be there for our kids. We want to make sure everything's okay. We want to protect them, make sure they don't get hurt. But the reality is that, they need to kind of grow up, and they need to kind of, accept responsibility for their lives. And then so when they're in elementary school, you can kind of hover, and they may or may not notice so much. But honestly, by the time they're middle school, they're kind of saying, yeah, mom, you're hovering, so they can already kind of tell what you're doing there. And by high school, you're lucky if they're just saying, ha ha, because they can tell what's going on. So how do you cut the cord? How do you sort of set things up for success? I have a really close and dear acquaintance and a fellow parent who wrote this book for parents and educators of blind and visually impaired children. And the title is Getting Ready for College Begins in Third Grade. The same holds for IBD. You want to start already kind of setting the set for your child to, like as early as you possibly can for things to be successful. Now, how do you create a foundation for a child's success? I think it's super important to connect with other parents. And you guys have the SCD community. That's phenomenal. I am connected to other blind parents through the internet as well, all over the world. And it's been an invaluable resource for me. So that is just super important. I'm also connected with a variety of different blind organizations and sub-organizations where I can tap into the resources. So if I don't know how to do something or a question on something, I can ask someone who's really living it, and they give me feedback, or they give my kids feedback, and it just makes all the difference in the world. So, when I learned about, what Jeffrey's been doing here, I was just really moved, and the more experience I've had with it, I just really applaud you guys. You want to find adult and peer success stories and role models and mentors. That is just really, again, very critical. And teens need to connect with other teens and both with and without IBD. I remember my wife sharing me the story of when she took my son to the aquarium one time when he was like about 5 years old, and some kid made a comment to their parent, and their parent said something about my kid having a cane. And he asked, Mom, where are all the other kids with the canes? As a parent, that's kind of hard, to really digest, but the point I'm pointing this out because you don't want to feel isolated. You don't want to feel alone. A couple years later, we went to this one conference. It was a National Federation of the Blind conference, and we got in an elevator. It was a packed elevator. There was 12 people in there. Every single one of them had canes. And I can't tell you how thrilled he was. And at these conferences we go to, sometimes you see 3,000 people with canes. And so it really lets them know that they're not alone, and they can tap into and meet other people who are doing the same thing they're doing. And it's great. So from an IBD standpoint, there are opportunities too. There's obviously what you guys are doing here. The Crohn's and Colitis Foundation has something called Camp Oasis, which is designed for kids and teens, and older people can volunteer for that as well. I believe they support SCD because I think I've signed off on some forms for that for some of my patients. There's also local support groups. Maybe there will be sort of a teen subgroup offshoot of here now for the Specific Carbohydrate Diet Association, or maybe some teen will take on a YouTube channel, and kind of start their own kind of a get together that way. But again, it's real important, and it's real important to begin to share and to begin to take responsibility early on. So mindset's important. I think really knowing what life is going to be like when you're older and what life can be like is important. When you see people who are living the diet, living the lifestyle, you can see that it's totally doable no matter what you do. I take care of patients with IBD. I mean, in just the last month and a half or so, I've interacted with professional athletes with IBD and actresses. I got one who's a teen Olympic gymnast, teachers, doctors, lawyers, firemen, policemen, a comic book author, detective, moms, dads, grandparents. The list goes on. Really, the possibilities are endless. And someone with IBD can pretty much do anything they want to do. But it's important to connect and let yourself know that you're not alone. Buy-in's important. And that includes shopping and helping to prepare meals on a daily basis for holidays. So you know how to make a holiday meal, that'll work. I've a number of patients that are just super proud of their Thanksgiving meals, that are all SCD compliant, and their relatives may or may not even realize that. And vacation prep, because you need to know how to travel and stuff like that. And then, you need to engage in life. The National Federation of the Blind has a saying that, live the life you want. And I'm a firm believer in that. You don't let what you have going on stop you. But it doesn't just happen. You really have to design and lead your life. So, how do you navigate the system? It can certainly look like this sometimes, where it just seems like you don't really know where to go. You can't kind of see over the wall over there. And there's kind of seems like there's almost like constant barriers in there. Honestly, it looks more like the Tri-Wizard tournament maze in Harry Potter thing sometimes, because you're never quite sure what's going to be around the corner. You have obstacles. Even the maze seems to kind of block your path sometimes. And if that doesn't get you, you can even psych yourself out just from the environment and stuff like that's there. So, I get it. I've seen doctors all over the country for my kids. Between the two of them, they've had over 20 surgeries. We've disagreed with medical professionals and local educators, including our local blind educator experts, a number of times. So I understand kind of what that's all about. I haven't actually read this book, but when I was kind of just Googling some pictures, it kind of just popped up. But I think the title is really neat. Prepare to defend yourself, how to navigate the healthcare system and escape with your life. And I think a lot of people here can probably relate to that kind of a title. And honestly, in the beginning, you kind of want the doctor to take everything for you. It's not going to happen. And I pulled this off of a website I'm putting together, actually, but for other stuff. But it's like the superhero in there, for all practical purposes, got to be you, mom and dad. So let's look at the medical system. Some people talk about different ways of presenting all the medication options out there. I kind of use a menu option because I like nutrition, but also because it sort of sets things up, I think, kind of nicely this way. Now, the reality is that there's lots of different options out there that depend on, how sick you are. And we have often will combine different things. There are things that are very classic that we use. There's things that affect the immune system. There's other ones that don't. We do take into consideration age and gender and things like that as well. And, the reality is that these sort of more selective things like specialized diets and therapeutic diets are things that are going to be not all over the place, so you kind of are going to have to learn about this a lot for a large part on your own, unless you have a center, get access to a doctor and team that really is aware of this. So, what my wife and I have learned is that you really still need to sort of work with what you got, so, look at what you have in your system, accept that there's going to be limitations, and then work with that. You're going to bring stuff to the table. So it's important to get informed. You get informed by arming yourself with data. Data comes from attending conferences like this. It comes from connecting with other parents and other people, doing living life the way you want to do it, to get kind of pointers and to learn things. You want to still partner with your local pediatric GI team. That's still very doable most of the time, especially pediatric doctors in pediatric IBD. The diet is much more acceptable to them than when you get to the adult world, although that's gradually changing as well. If you can always seek like an expert IBD consult as a backup. So, there are a number of doctors around the country who do believe in the SC diet and in lifestyle and things like that. I have patients that come to see me from all over the place for like a one-time consult, or maybe they'll come back every couple of years. And then what we do is we, meet with them, kind of put together a plan, and then we send like the whole plan back to their local doctor, and then they work with their local doctor. And then at that point, most local doctors are willing to kind of accept things, because you have sort of an expert kind of opinion, sort of validating or taking responsibility for things there. So that's just a strategy to think about. It's really worked, I think, for a lot of people who have seen me. I'm going to throw that out there as an option, so you don't feel like totally lost that way. The way I learned about SCD was from one of my patients 25 years ago. She came in, she's feeling great, and she gave me, the Breaking the Vicious Cycle book, which I looked at, I thanked her, I put it up on my shelf, and it sat there for a little bit. But I had more patients coming and telling me, boy, this SCD thing works. And so I picked up the book, actually read it, and I gradually learn more and more about it. And instead of being more passive in that area, we now actually help guide people through, SCD. I have a dietitian I work with very closely, who's been on diet for a bit too. She tries everything that we offer here. And we put together a whole bunch of resources so that people don't just sort of, kind of walk out saying, good luck, right? We don't, if you start someone on, say, one of the biologic drugs, we don't just say, come back and see me in 2 years. It's kind of like, you come in, you get followed through and stuff like that. So we put together a bunch of resources. I've got my, Liberated Specialty Foods, a little pamphlet here. I've tried a number of their things that I think they're really good. I haven't had a chance to try the commercial yogurt or ice cream yet, but that sounds quite intriguing. All right, so how do you navigate the educational system? So, students with IBD, and I pulled this off of a website, but students with IBD may need to use the bathroom more frequently. They may need to sit closer to our door or background. They may need a water bottle to help prevent dehydration. May need to have permission to eat small snacks, and you're not supposed to snack in school or have food sometimes. We can arrange for special diet accommodations for kids who are at college and you're having to go with the school menu because they're staying in school there. You may need to be able to have permission to go to the nurse more frequently, maybe even to change clothes if something happens, extra time for assignments, tests, homework, permission to miss school if need be, or come in late, because of your doctor's appointments, or you just had a really rough night. Or you may feel kind of tired or embarrassed about certain things. So there's something called a 504 plan that you should be aware of. There's also another one called an IEP. IEP is for other kinds of disabilities, but a 504 plan basically sort of sets the framework with the school. It's kind of like a contract between you, your child, and the school system in terms of things that they have to accommodate. I'll put this link in the chat a little bit later, but the Crohn's Colitis Foundation has a really nice sort of 4-page fact sheet that kind of walks you through what a 504 plan is, kind of how to phrase things. It'll talk about what you can do, what you can't do, how you put this together. If there's disagreements with the school, how to kind of address those. But it's a real neat tool. And adults in the workplace also have accommodations that they can get as well. And that's really what our social worker helps our patients with, is helping with these types of things. So and then you just have to sort of work with the with the local system there. So I'm going to kind of wrap it up for the formal part of the presentation here. And then I'm open to answering any sort of questions that anyone might have. Thank you.
Okay, I'm back. Thank you so much, Dr. V. Sue, do we have questions?
Hi, everyone. This is Sue Meyer. I have some questions for Dr. V. We'll start with the one that's in the chat right now. And essentially, we are asking if, or was, our child was diagnosed with Crohn's at age 10 and is on methotrexate and essentially symptom-free for the last 3 years. If we wanted to reduce or otherwise experiment with his medication, at what age would be a safe time? Of course, assuming no flares of symptoms. He is currently on SCD.
So, the most important thing is to get into remission. Now, there's different levels of remission. So I kind of talk about like inflammatory bowel disease, what's going on in the gut, is sort of, imagine it sort of as either a campfire or maybe even a forest fire, So you have these flames kind of burning there. If you sort of put it out, but you leave embers kind of smoldering in there, if you stop paying attention to those embers, they'll kick back up again. So embers would be like when you feel better, maybe your labs are even normal. But unless you look inside and actually document that there's no more inflammation, you can't really be assured that the embers are kind of put out fully. So you do want to make sure that even if the labs are normal, that you look inside first and are in what we call deep remission. Deep remission is when you're feeling great, the labs are normal, the scope looks completely normal, or the capsule, whatever it is, you need to do to kind of document that there's no inflammation there. I wouldn't rely on x-rays alone. And the biopsies show no inflammation. If you still have inflammation on the biopsies, you got smoldering stuff there. And if you back off, you risk it just sort of taking off again. So too many people make the mistake of getting to the point where they feel better, and then they either stop their medication, they pull back the medication, or they broaden out their diet and they stop doing that. And then lo and behold, either a few weeks or maybe 6 months later, they're flaring again, so that can certainly happen. So you want to keep the inflammation completely quiet for about a year and a half, and then you can start to back off. And so when you back off, you need an exit strategy. That exit strategy might be medication, it might be diet. So when someone achieves deep remission, and let's say for the argument's sake that they're on 2 medications, they're like maybe on methotrexate and a biologic, and they're on SCD. Usually we back off of one first. Most of the time it's going to be like either 6-MP or azathioprine or the methotrexate. But other people have different preferences for different reasons, and that's fine. So if in the case of methotrexate and SCD, I do think that if you can stick to SCD as your maintenance therapy and be committed to it and not give up on it, that you could potentially try to back off the methotrexate. I usually do that by gradually lowering the dose and then kind of following labs. And then a year after stopping it, I take a look inside with the scope again, just to kind of make sure that indeed everything is quiet that way. And then we see how things go. Other people, want to sort of broaden out their diet. Now, if it were up to me, I would honestly stick with SCD strictly. But I know that doesn't work for everybody. And so some people, miss certain things. And so, if someone's in deep remission and they want to broaden out their diet, I might try that first if they're willing to stay on their medication. I think a lot of people are willing to stay on milder medications, things like we call mesalamine or 5-ASAs, things like Azicol or Lialda or Pentasa. People are often willing to stay on those types of medications because they can keep the inflammation kind of, quiet in the background. They're not really suppressing the immune system. But it really just depends on what you want to do. You need an exit strategy. It needs to still be a maintenance therapy. It doesn't have to be a drug. It can be the diet. But the moment you start playing around too much with diet, you start risking flares. So it's just something to be aware of. I actually also use quite a bit of turmeric as sort of an additional natural supplement. And make sure it's SCD compliant. But I think that also offers a little bit extra buffer to be able to kind of then, either back off medications or perhaps expand diet, or maybe not be 100% quite as strict, like to go out to a restaurant or something like that, type of thing.
Dr. V, you're awesome. I wanted to jump in because I've always wanted to ask, I tend to ask, but out of all your patients that you see, I assume it could be hundreds and thousands of people. What percentage follow the diet, do you think, 100%, and use that as a maintenance? And what percentage of people that you see generally are following medication?
It's going to vary from practice to practice.
Of course.
Even in our group, it varies a lot. I mean, people tend to gravitate towards me when they want to try kind of more natural things. But I use everything because we need to. I never have a clinic. I see patients twice a week in the office in the clinical setting. I have one of the busiest practices for IBD around, I think. I never have a clinic where there isn't someone on IBD, on SCD. So I have usually at least 2 to 5 patients, maybe any given clinic day on the SCD diet. It varies over time. I have people who have been on SCD. I think the longest I've had someone that I know of continuously on SCD is about 18 years right now. And he's overall doing great, but he does need some medication to really stay in full remission. Because again, everybody is different. It's a real hard question to answer because I have a lot. I mean, I've taken over 200 patients through IBD, SCD over 20 years. I'm sure more than that. And I know my partners are starting to incorporate it as well, through our dietitian and stuff like that. It's just a hard question to answer.
Okay, that's okay. I mean, when I can follow up and just say in the SCD survey that we just completed, there was 47% showed that they don't take any medication, and then 22% take the mesalamine product to maintain maintenance. And then of course the other types of medications follow through in the rest. But it's a choice, and I understand what you're talking about with deep remission. So I appreciate it. I just wanted to follow up and just ask that in general.
Yeah, no, I do have a lot of people that I said them, almost everybody in my practice who goes on SCD has already been recommended to go on a biologic, and they either don't want to do that, and then we try this and maybe perhaps some other things as well that are not necessarily medication based. And then there's a lot of people that will, they're already on a biologic or they're on a combination of things, and then we incorporate diet into that, with the goal of eventually kind of backing off of that. And people are able to then successfully do that. I think the biggest problem is just that, the power of denial is just astounding. People will try something and it doesn't bother them. And it doesn't have to physically bother you to start to cause inflammation inside, so they'll start to then, cheat a little bit more frequently. And then before you know it, something's already happening, so, and then it's like, this isn't happening to me. No, this is just my SIBO. This isn't happening to me. And then before you know it, you're flaring again, so I think it's just the, sticking to it is the hardest. And there are times that are challenging in life. I think, the transition from like high school to college is a challenge, because a lot of kids will go, or young adults will now go away to, to school, and there's different pressures socially. There's different, they're not at home anymore. Mom and dad aren't there to kind of help make meals. So you have to either rely on the school to do that. You have to have lots of available snacks, ready to go. You have to know how to do it yourself. You have to be wanting to do that, and know how to, deal with the social pressures there. But I've got people who are super busy, lawyers who have super busy practices that just take the time and do SCD, whether they're doing it on their own or whether they have a significant other spouse that's helping them out with that, to kind of help, be their support system there. It's it totally can be done. I mean, if I don't have IBD, but if I did, hands down, I would absolutely be on SCD 100%, and I don't say that lightly at all.
Sue?
Okay, just wanting to see if we were continuing along in that vein. We have a bunch of questions in the chat, and I'm not sure we'll be able to get anywhere close to answering them right now. However, we can go here. Excuse me. The question is, what might cause a lack of hunger in my 18-year-old son? No GI symptoms, he's underweight, mildly autistic, had milk allergy as an infant. He simply does not feel hungry enough to eat more food. No evidence of depression or eating disorder. The mom has a history of UC since a teenager.
I mean, there's a lot of different reasons. Including just an individual child. I have one son who, will eat and then he'll leave like one thing in his little, like snack thing or something. It just, he just knows when he's full. He's not hungry in between. So some kids are just like that. There's different reasons. There could be some inflammation in the stomach. It could just be their preference. Sometimes medications can affect your diet. There's lots of different potential reasons. Without really kind of diving into the specific situation, it's a little bit hard to say.
Thank you, Dr. V. Another question. Would like to know what you think of the modified SCD diet, such as adding in cocoa and potatoes, et cetera. Earlier, you had mentioned that you believe it should be strict.
Yeah. So, I think there's different phases of the disease, so if you're sick and you're trying to get into remission, right? And by that, I mean deep remission where there's no more inflammation. That first phase has to be 100% strict. If you're not strict, it's just not going to work. So I'm often faced by, I tell patients when they start SCD or thinking about it, I go, this is what I want to avoid this scenario. I want to avoid the scenario where you start SCD and now you come in at a year for a scope. And I always do that after a year anyways. And the idea being that at a year, I expect to see improvement. I don't expect to see full healing yet if SCD is the main therapy that's there. So when I see patients at that year time point, I ask them how it's going. Most people are feeling well. Usually their labs are normal. And then I ask them, so how's the diet going? And if I get the response of like, great, I'm like, okay, good. We're not going to see a lot of inflammation here most likely. Or it's like, pretty good. It's like, what does pretty good mean? Like, well, I do it like, 85, 90%, or, I cheat this like once a week, I know I'm going to see more inflammation in that patient. And then when I come out, I show the pictures, and usually there's enough inflammation there that like, we need to do something different. And then so I say, look, it seems like SCD is just a little bit too challenging to do it strictly. So why don't we talk about some medications? And all of a sudden people are like, whoa, Dr. V, I did it great the first 6 months, strict, and then I went to a party or, I went to a family gathering, I tried something, it didn't bother me. So, or I missed this because I really like, rice or chocolate, so I just have a little bit, here and there. And they're like, can I do strict SCD for another year? Can we reassess? I'm a bit of a softie. I'll usually say yes, and then a year later, I mean, that inflammation is either gone or virtually gone, so strict makes a difference. And again, you want to maintain that level of lack of inflammation for at least a year before you start to experiment too much. At that point, I think that some people can get away from if SCD is like their main therapy, or maybe they're doing it in combination with like one of the, mesalamine, 5-SA drugs like the, azacitidine, the pentase type things. Some people can get away with adding in some things every once in a while, maybe going to a restaurant, not worrying about being like 100% fanatical about, like asking the waiter about every single ingredient in there, or maybe do like a cheat day. I mean, they're not going to McDonald's or anything like that. I don't know anyone who's been on an SCD diet with me who's taken it seriously, who's actually gone, who's then moved away from that diet, who's actually gone back to eating like really junk diets, so they're still eating overall very healthy, generally avoiding processed foods and stuff like that. So some people can get away with it, but then, we repeat a scope after about a year, and again, see where we're at. And always use that as a barometer. And I'm emphasizing scopes because that is the most direct way of looking at things. I know a lot of people rely on things like, the SED rate and the CRP and the stool calprotectin. But if you go on SCD, those can normalize, but you can still have inflammation inside. I don't know what it is about SCD and grain-free diets without processed foods in general, like paleo or autoimmune paleo. But with all those diets, very often the markers will totally normalize. But if you look inside, the difference between SCD and those other diets is that strict SCD knocks out the inflammation completely. The other ones may help a little bit, but they don't get you across the finish line. And so that's just been my observation. And if you look at Dr. Susskind, I know he's going to be on, or he may be on right now, can comment on it. But he did a study where he actually looked at follow-up scopes on patients who've been on SCD and found that a number of them still had active inflammation. But if you look at the details of the study, you'll find that they were almost all on modified SCD, which is what the question was kind of alluding to, and they still had active inflammation. So in my mind, it's the strictness that makes a difference.
And I would just like to follow up as a person that's been following SCD for 25 years. It is a slippery slope, and it is very hard and very challenging. And whether or not I was traveling the world in my career or whether I was at home, peer pressure was one of the biggest things that destroyed me a few times. And it is important that if you do follow it 100%, you will be able to maintain it. And it's a daily challenge. And I'm so fortunate to be able to look back at Elaine and say, well, of course you named the book Breaking the Vicious Cycle, because that's what it's all about. It's breaking the vicious cycle of going back to these addictive foods that, were all started back when the Farm Bill happened in 1993. And she started her book in 94. Why? Because of the Farm Bill and the changing of our food supply. So that was my wake-up call at that time. But yes, I've had my wake-up calls over the last 25 years, and I just, you talk about inspiration, for children, and I always look to like Judy Herod, who's, now in her late 60s, and I'm only in my late 50s. So I can look to her and say, well, if she's done it for these 60 years, that's my inspiration to continue doing what I do. So it's great. And I think the conference like this and the kids conference will hopefully further inspire people to stay 100% so that you don't need to have a maintenance medication. So go ahead, Sue.
Learn from the experience of others. Yes.
Exactly. Next question. How can you convince a pre-teenager that diet is better than medicine? Because it's really hard because this child cannot eat sugar and the snacks that she likes. What would you recommend?
It's all a process. I think it's going to be really hard to go from, for most people, from eating a typical American diet to SCD if they're younger. It's hard for older people too. I mean, some people come and see me and we talk about how strict you have to be. They'll tell me, Dr. V, okay, well, maybe let's talk about those medications again. What I didn't really do. So I mean, that happens. But it's, with a young child, I mean, basically their access to food for the most part is going to be through home. I mean, they may have some access at school, things will happen, but you teach them gradually. And it's just something you kind of have to gradually work on, come up with creative alternatives. I am just amazed at how creative some of my parents are, of kids who are doing SCD. I had one parent recently, I don't know if she's on the call or not, who was telling me that she gave her kid chicken nuggets, and I'm like, chicken nuggets, but she had this whole thing. I mean, it was like all involved, but I mean, man, it made my mouth water, so she recreated like real chicken nuggets for a kid, so, and once you've been doing it for a while, the stuff that you really craved and wanted doesn't taste the same anymore, I mean, you're going to go have like a piece of chocolate cake. It just doesn't taste the same. My taste, I mean, I don't eat SCD, but I have very strong SCD tendencies. So I eat very clean overall. And I just can't do some of that stuff. I mean, what used to be appealing to me, it's not anymore. I'm not even tempted by stuff at work and things like that. I bring my own snacks to work. I eat my own, I know what that's like. With my kids, I mean, I know that when they're not around, they're out and doing things, they'll sometimes, do stuff that they probably shouldn't, but, their overall choices now are just astoundingly much better. And it's amazing how if it comes from the parent, it doesn't always resonate, but if they meet like other kids or teens their age who are doing it that they can relate to, or they meet other adult mentors or models that they can see that other people do this, then they start to realize that, oh, this isn't just me. It's not just I'm the only one doing this, but like other people do this too. That makes a world of difference. It's just that feeling of it's not just me. It's not a punishment, but like, it's really connecting with others and taking ideas from other people on how to make it happen. Because I mean, everyone who does this is going to be creative, but you can really pick up neat pointers from other people, especially like the Facebook group and stuff like that too. I think, lots of great things that I hear, passed back and forth there.
Thank you, Dr. V. What is the long-term prognosis for pediatric patients since they are diagnosed so young? Can you fail off of strict SCD the way you can fail off other therapies?
Absolutely. Yeah. I mean, again, you need I mean, not everybody responds. I would say that the main reason for not responding to SCD is going to be not being completely strict with it. That would be the main reason. But even if someone does it completely strictly, there's just a number of patients that don't respond fully to the diet. So then, I mean, that happens just like with any medication. If you look at almost any therapy for inflammatory bowel disease, I'm going to make a broad generalization, about 2/3 respond. By respond, I mean 2/3 of patients trying any intervention, any medication you can pick, diet, about 2/3 get significantly better with that. About 1/3 go into remission or so. But that's in the short run. Things can still kind of, kick up later and stuff like that. You still need some sort of maintenance strategy. If it's not going to be diet and lifestyle, it's going to be medication, because eventually it'll come back. Prognosis for patients with IBD, no matter what age, overall is very good. I see, patients that, had like Crohn's or colitis when they were really young, and they were talking about surgery, and they've been on tons of steroids, because back then we didn't even have things like biologics and stuff like that. And fast forward now, 20 years, and they're on next to nothing. I mean, they're doing great, and that bad 5 or 10 year period in their life or 2-year period in life is just sort of a footnote at this point because they're doing so well. So it can kind of burn out, you know, in some people. It doesn't do that for everybody. But I say as people get older, as a general rule, it very often can quiet down. But you know, everybody's different. And if you let your guard down too much, and, you know, it can just sort of really flare off, you know, so you always want to be aware. And I think you need some sort of maintenance strategy. And, you know, again, whether that be diet or medication or some sort of herbal thing, you know, there are options out there as well.
Dr. V, I'll share just one more thing with you. One of your former patients is in the audience today. He wanted to say hi and thanks, and he was your patient as a teenager from 1999 to 2002. He's 34, and his name is Sean Ahrens.
Hey,
Son of
hi.
Holly Ahrens. So he says thank you so much.
Awesome. You're welcome.